Welcome to Coronavirus Boosters for the week of January 11, 2021. This series is brought to you by the Cornell College of Agriculture and Life Sciences Dairy Foods Extension and the Institute of Food Safety at Cornell University. And this program is supported by USDA and NIFA. The numbers of COVID cases, hospitalization, and deaths this week look bleak, as they have been for a while. We can see in these graphs that were updated as of today, January 11, that the numbers of daily cases are going nowhere but up. The number of deaths are going nowhere but up. We see two dips, Thanksgiving and winter holidays, Christmas holidays, but the number of hospitalizations going continuously up and the number of cases going up. So for food industry and everyone else out there, continued vigilance, continued reinforcement of the proven practices to prevent COVID-19 transmission is so essential. For those of us in New York, you can see our numbers look pretty bad too, in terms of we running very much around a 10% positivity rate, except for the southern tier and maybe New York City, which is very, very high. Numbers that 2-3 months ago would have been very atypical for New York. So the situation is really bad everywhere. So what I want to do today is just give a short update on two things. The SARS-CoV-2 is a virus that causes COVID mutants. We hear a lot about mutants, and then a little bit about vaccinations. So when we hear mutants, we always think something really, really bad. We forget that mutations is a natural process. Mutations occur, and they're not always bad. Sometimes mutations might make a virus less likely to cause disease, may make it cause a less severe disease. So don't automatically associate mutations with bad and things are getting worse. Important fact is, SARS-CoV-2 is an RNA virus and it is spreading fast. Both of these things contribute to it accumulating more mutations, so it's mutating fast. This doesn't mean this is a fast mutating virus. It's just all RNA viruses that would spread fast would mutate at a fairly high rate. A little bit of nomenclature. If you have mutations, which are changes in the genetics of the virus, this leads to virus, what we call variants. Sometimes you might hear people refer to them as strains. There are a number of different SARS-CoV-2 variants around that cause infections around the world. But a lot of talk in the last few weeks has been about one variant that sometimes is named B.1.1.7, which has been first reported in England and has been proposed to spread more rapidly. Now, we don't know 100% sure what that does. It could be there's more rapid spread in England and the virus is B.1.1.7, or it could be that B.1.1.7, the unique genetics of B.1.1.7 contribute to its ability to spread fast, more rapidly. For those of you who've been looked into this more deeply, there's a similar variant that has some of the same mutations, and it also may spread more rapidly, has also been independently emerged in South Africa. And as most of you will know, this variant, the B.1.1.7, has now been found in the US in multiple states. So while this variant may spread more easily, as I said, the final word is still out, other concerns about this virus are not warranted. The vaccines still work, pretty clear, pretty good evidence. The tests we have still work, so if you're infected with this virus, it will be detected. So, some concerns out there, some valid concerns out there that lead us to continue to recommend to reinforce prevention strategies. But the disease caused by B.1.1.7 is not more severe. And what we do and still works if we implement it consistently. Another concern, another thing we've heard a lot about is vaccinations occurring slower than anticipated. You combine those two things, more rapid spread, potentially more rapid spreading variant out there, and vaccinations not happening as fast as we were hoped to, obviously cause a lot of angst and may further slow down our ability to control this pandemic and get it under control. There's some good news on the vaccine route, though. I mean, we've worldwide inoculated a lot of people with the vaccines. Not as many as we wanted to, but still a lot. The reports of anaphylactic reactions, which you heard, so allergic reaction after vaccinations, are rare. They do occur, but they're rare. But there have no serious issues or side effects of vaccines have been reported to date. With the anaphylactic reactions, there's some precautions to take if you have a history of anaphylactic reaction, a history of severe allergies. Now, if you typically carry an EpiPen around with you wherever you go, do make sure you get the vaccine seen at a location where they could treat you if you show an anaphylactic reaction. I'm not a doctor. This is not medical advice. Obviously, you should discuss this with your doctor, but this is the basic advice that is out there. What are some overall food industry take-homes from what we've seen over the last few weeks? With the new variants out there, with the prevalence increasing, with the numbers going where we see them going, it's so important to re-emphasize the importance of social distancing and proper face mask usage. It seems like, in workplaces, we have been able to be very successful. We haven't seen those big outbreaks in food processing facilities, but now it's important to work with your employees to emphasize why it is so important to stick with the plan outside of work, when you go home, when you have days off, on the weekends, etc. That's what we need, and we need everyone to re-emphasize this. The other important thing is to prepare for vaccine rollout. Assure that your staff get scientifically accurate information about the vaccines. So then when the vaccine becomes available, they really will get vaccinated. It will be a considerable problem issue if a large proportion or a decent proportion even of employees would not be vaccinated. So let's start with that. Also start planning, make sure the communications are clear that even after vaccination, at least for a while, people will be expected to continue to wear face masks. They'll be expected to continue to do social distancing until we can see that the vaccine really gets this pandemic under control. So in this case, a little bit more, more of the same: face masks, social distancing, hand washing. All these practices we and others have emphasized for the last almost 12 months now are still our first line of defense, and we need to stay strong on those. With this, I want to acknowledge the USDA NIFA funding for this project and this short video. And as always, as I said multiple times, keep practicing social distancing, wear face coverings, regularly wash your hands with soap and water, or use the appropriate sanitizer. Stay healthy, and as always, contact us with any questions you may have.